We all feel very helpless. Many times it happens in our life because of certain circumstances, because of certain tragedies occurring in our life. We feel that all hope is lost. There is no hope left in life. We feel that we cannot change our circumstances. We have all felt that at some point in our life, haven't we? Well, this concept is called as learned helplessness. What is learned helplessness? Learned helplessness occurs when a person who has experienced some repeated challenges or some tragedies in life, they believe that they have no control over their life situations. They give up trying to make changes to their life and they just accept their fate. Even in animals, learned helplessness occurs when animal is repeatedly subjected to aversive stimulus that it cannot escape. So eventually the animal will stop trying to avoid the stimulus and behave as if it is utterly helpless to change the situation. So even when the opportunities to escape are presented, this learned helplessness will prevent any action on the part of the animal. We have always seen the example of an elephant which is just tied to a hook, right, which is tied to a nail on the ground. If possible, if the elephant is absolutely free to just break away, to break free, but it doesn't do that. Why? Because of learned helplessness. This concept also applies to human beings. For example, poor performance at work or at school, even after putting in a lot of effort, can lead to feelings of learned helplessness. People may be left feeling that no matter what they do or how hard they work, nothing will make a difference. Right? So, what are the symptoms of learned helplessness? Everyone can struggle at times, especially when coping with adversity and setbacks. Learned helplessness is characterized by more lasting symptoms like avoiding decisions or a bad attitude, just giving up quickly, or inability to tolerate any frustration, lack of effort, low motivation, passive behavior, poor self esteem, procrastination, just refusing to try, just giving up. It's not a mental health condition, but it can sometimes lead to some mental disorders like depression or anxiety. Right? So, how was learned helplessness actually discovered? The credit goes to a psychologist called Martin Seligman. Martin Seligman actually did an experiment on dogs. He initially observed helpless behavior in dogs that were classically conditioned to expect an electrical shock after hearing a tone. Later, the dogs were placed in a shuttle box that contained two chambers separated by a low barrier. The floor was electrified on one side, but not on the other side. The dogs, previously subjected to classical conditioning, made no attempts to escape, even though avoiding the shock just simply involved jumping over a small barrier. So initially, these dogs were given a lot of shocks and they could do nothing about it. So they developed an attitude of learned helplessness. So now these dogs which were conditioned to think that they could not escape their situation, when they were put in this box where they could actually escape the situation by just jumping the barrier, but still the dogs didn't do it because they had developed an attitude of learned helplessness. To investigate this phenomenon, he devised another experiment. In the first group, there were dogs which were strapped into harnesses for a period of time and then they were released. In the second group, the dogs were placed in the same harnesses but were subjected to electrical shocks that could be avoided by pressing a panel with their noses. And in the third group, the dogs received the same shocks as those in the group second, except that those in this group were not able to control the shock. So second group was able to control, but third they had no option of controlling the shock. For those dogs in the third group, the shocks seemed to be completely random and outside of their control. The dogs were then placed in a shuttle box. Dogs from the first and second group quickly learned that jumping the barrier eliminated the shock. However, those from the third group made no attempts to get away from the shock. Right? So in Seligman's experiment, the dogs who were unable to escape the shocks, they had developed learned helplessness. Due to their previous experience, they had developed a cognitive expectation that nothing they did would prevent or eliminate the shocks. Now, what are the causes of learned helplessness? It is frequently as a result of experiencing some stress or some trauma. People may feel that they have very little or no control over their situation. Because of lack of control, people may feel helpless and unmotivated to take any action. It can be abuse, it can be a bad boss, it can be that you have worked very hard for a particular exam, but still you couldn't clear it. It could be childhood neglect, difficult childhood. It could be domestic violence or natural disasters. Many times it happens that in countries where there have been floods or earthquakes, the people there feel absolutely helpless over their life, over their situation, or some kind of trauma. People who experience terrorist attacks or shootouts, they often develop an attitude of learned helplessness. Even overparenting can also contribute to the development of learned helplessness in children. When children are not allowed to try things independently, they may develop a poor sense of personal agency. Instead of trying, they believe that they are unable to do things and they don't put forth any effort, right? So why do some people develop learned helplessness but other people don't develop it? Why is it specific to some situations? Basically, explanatory styles may play a role in determining how people are impacted by this concept. It suggests that an individual's characteristic style of explaining events helps determine whether or not they will develop learned helplessness. Basically, it means that people who look at the positive things in life, who are more optimistic, they are less likely to develop learned helplessness because they always feel that they have control over their life and they can change their life, they can work hard the next time. But more pessimistic explanatory style, it is associated with a greater likelihood of experiencing learned helplessness. People with this explanatory style, they tend to view negative events as being inescapable and unavoidable and tend to take personal responsibility for such negative events. Now, what is the impact of learned helplessness? Right? This impact can be seen in many people. For example, just a child who performs, let's say, very poorly in history test in a school, he will feel that whatever he does, he will never get good marks. So he may feel very hopeless and not do the work. Because he doesn't do the work, he scores even poor marks in the next test, and this vicious cycle continues, right? So this learned helplessness basically leads to many psychological disorders: depression, anxiety, phobias, shyness, loneliness. All of them are enhanced or exacerbated by learned helplessness. For example, feeling shy in social situations can cause people to feel that there is nothing they can do to overcome their symptoms. Because symptoms feel out of control, they may stop trying to engage themselves in social situations, and thus they may actually enhance their shyness. So it's like what they were fearing that actually comes true. A student who experiences learned helplessness with regards to his history test will not necessarily experience that same helplessness when faced with performing calculations or doing math, right? So people may experience learned helplessness that generalizes across a wide variety of situations, or they may not feel generalized learned helplessness either. So it depends like that. Now, learned helplessness often originates in childhood, right? Unreliable or unresponsive caregivers can contribute to these feelings. Children raised in institutionalized settings often exhibit symptoms of learned helplessness during infancy itself. When children need help but no one comes to their aid, they may be left feeling that nothing they do will change their situation. Repeated experiences that bolster these feelings of learned helplessness can actually result in growing into adulthood ultimately feeling that there is nothing they can do to change their problems, right? Now, learned helplessness can also result in anxiety, depression. Kids feel that they have no control over the past events of their life. They gain the expectation that future events will just be as uncontrollable, so they just stop trying to improve their life situations, right? Now, what can be done to overcome learned helplessness? What can people actually do? It can be decreased, particularly if intervention occurs during the early stages of life. It can be reduced, although it may take a longer term effort. First thing that can be done is psychotherapy. Therapy can be effective in reducing symptoms of learned helplessness. Cognitive behavioral therapy is a form of psychotherapy that can be beneficial in this regard. It helps patients to identify negative thought patterns that contribute to the feelings of learned helplessness and replace these thoughts with more optimistic and rational thoughts. Another is self-care strategies, right? Self-care strategies like getting enough sleep, managing stress levels, eating a healthy diet can actually give people, a greater sense of control over their life. A social support is also very important. Getting social support and encouragement from others may also be very helpful. When you feel helpless in the face of a challenge, supportive people can help you feel more motivated and encouraged to keep trying. With time and continued practice, you can eventually acquire successful experiences that help you feel more in control, right? So, learned helplessness can have a profound impact on mental health and well being. People who experience learned helplessness are also likely to experience symptoms of depression, elevated stress level, and less motivation. Right? So, if you feel learned helplessness might be having a negative impact on your life, you can actually, consult some therapist or actually take professional help if needed. Thank you so much for listening.